Hello, my friends, and welcome to Wellness Wednesday. My name is Jamie Neal, advanced practice registered nurse and certified nurse midwife, and I am so glad you are able to join me today. We would like to share with you a few things about some common problems with breastfeeding. 3 problems I would like to point out that are very common when breastfeeding are pain, nipple and breast pain, infection, or inadequate supply. So first, speaking of pain, usually it starts at the nipple, and a lot of times that happens because of a poor latch. So the first step is to ensure that your baby is latched properly. Sometimes when you first latch the baby, you might feel a little bit of sharp pinchy type pain, but it should relax and get better. Sometimes when you have breast pain in the breast and not the nipple, it could be a sign of infection. So if you have redness and pain on your breast, especially if you start to run a fever, that possibly could be mastitis, which is leading into our next topic, infection. Many times, the 2 most common infections that happen at the breast is mastitis. That means that a milk duct is clogged a little and now has become infected. And so for that, you would need to see your medical provider and get an antibiotic and drink plenty of fluids and take Tylenol so that you can feel better. If the other infection that likely happens is on the skin, and that is thrush or a yeast infection. Sometimes babies can get that in their mouth as well, but a simple cream, you can even use over-the-counter vaginal yeast cream if you'd like, but just make sure you wipe it all off before you feed your baby. Another problem that people encounter is inadequate milk supply. The first tip I want to tell you about milk supply is be sure that you are appropriately latching the baby very often. A lot of women may feel that breastfeeding for a long period of time might be helpful to their supply, but really it's how often you're putting baby to breast. So even if the baby's at the breast just for a few minutes and you're skin to skin bonding with baby, that helps to bring your milk in faster and give you a bigger supply. Then after that, if you're still worried about your milk supply after knowing that you're breastfeeding very often, you want to make sure that your baby is pooping and peeing appropriately for the age of the baby. You can always feel free to make an appointment to come see me. I will be glad to take care of you at Lifetree Women Care on 5500 Blandon Boulevard. You guys, I hope you have a wonderful day and take care, and I'll see you next time. Bye.